Assalamualaikum warahmatullahi wabarakatuh. My name is Athirah Filzah binti SUPARMAN.
My name is NURDARWISYAH binti NURAZMAN.
My name is NURELYSA binti OTHMAN.
My name is AMALIA binti SHAMSHUL.
So now we are going to present about mental health. Next. What is mental health? Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right, and it is crucial to personal, community, and socio-economic development. Mental health is more than the absence of mental disorders. It exists on a complex continuum which is experienced differently from one person to the next, with varying degrees of difficulty and distress and potentially very different social and clinical outcomes. Mental health conditions include mental disorders and psychosocial disabilities as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. People with mental health conditions are more likely to experience lower levels of mental well-being, but this is not always or necessarily the case. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Next. As you can see here, this is the table of analysis who affects with the mental health in Malaysia, based on Ministry of Health Malaysia Mental Health Care Performance Report in 2016. Most of it requires immediate attention and remedial action since it keeps increasing drastically from 2014 until 2015. Next.
What is problem child abuse issue? Child abuse involves doing something or falling to do something that results in harm to a child or puts a child at risk of harm. Child abuse include physical, emotional, or psychological and sexual abuse as well as neglect. In addition to the physical harm that can occur from child abuse, abused children can suffer intense emotional damage and can develop severe social problems, such as struggle at school and drug use. Other than that, child abuse is a child in the family who is development or physically disabled, such as financial stress, employment or poverty, social or external family isolation. They experience a higher likelihood of drug and alcohol use and associated problems as well as much higher rates of mental health problems, such as depression, anxiety, and suicidal thought. Child abuse can result in long-term physical, social, and emotional problems. Next.
Next, I will describe the effect on mental health from two angles. First is how mental health effect on physical health, and second, how mental health effect on social life. In physical health, we can get a chronic disease. Mental health has been linked to many chronic illnesses such as diabetes, asthma, cardiovascular disease, and arthritis. Besides, mental health condition can also make dealing with a chronic illness more difficult. The mortality rate from cancer and heart disease is higher among people with depression or other mental health condition. Second, we can get sleep problems. People with mental health condition are more likely to suffer from sleep disorder, like insomnia or sleep apnea. Insomnia can make it harder to fall asleep or stay asleep. Sleep apnea leads to breathing problem, which can cause you to wake up frequently. Furthermore, when having trouble sleeping at night, it will also interfere with our daily activity on the next day. So what we can sum up is while conditions like depression, anxiety, or bipolar disorder may lead to sleep problems. Sleep problem can also make existing mental health condition worse. Third is smoking. People with mental health condition are more likely to smoke than those who do not have mental health condition. Among smokers, people with mental health condition are more likely to smoke a greater number of cigarettes. People with a depression have a lower levels of the chemical dopamine. Dopamine influences positive feeling in your brain. The nicotine in cigarettes trigger the production of the chemical dopamine, so smoking may be used as a way to relieve symptoms of depression. However, since nicotine only offers temporary relief, they may feel a recurring need to smoke, which may lead to possible addiction. And lastly, difficult to access with healthcare. People with mental health condition are less likely to have access to adequate healthcare. It may also be more difficult for people with mental health condition to take care of their physical health. When you have a mental health condition, it can be hard to seek care, to take prescription regularly, or get enough exercise. Hence, there are many benefits we can get when doing this good routine. One of them is to be able to motivate yourself to be more enthusiastic and to be able to ignore negative feelings. And second, how mental health affects on social life. First is have a problem in social relationship. Influence people's relationship with their children, spouse, relative, friends, and co-workers. Often, poor mental health leads to problems such as social isolation, which disrupts a person's communication and interaction with others. This can have particularly harmful effect on children or adolescents whose development depends on forming bonds with their family members and peers. In adulthood, this social isolation can lead to family breakdown, divorce, or even childhood neglect. Besides, children who have family members experiencing mental health problems may blame themselves. This can result in loneliness and feeling of being different. It may also lead to future behavior or social problems. Additionally, as families address their loved ones' mental health problems, they may socially isolate out of fear of judgment from others, further disrupting their emotional well-being. Second, have a problem in studies. Many students experiencing mental health issues struggle to form positive relationship with their teacher. It doesn't matter whether the student from primary school, secondary school, or university. They may also find it difficult to concentrate, feel motivated, or follow school rules. This often results in disciplinary measures that can interrupt their learning process. And last but not least is have a problem at work. Mental health issue can also lead to struggle at work. Mental health issue often reduce concentration, which can compromise a person's productivity. According to the study from the National Alliance on Mental Illness report, that difficulty focusing often accompany depression. Depression reduce productivity can limit one's ability to earn promotion, excel, and build successful relationship with supervisor and co-workers, which ultimately affect job satisfaction. Besides, mental health issue can also lead to increased absenteeism at work. This can result in job loss or reduced hours, which affect a person's ability to earn a living. That is all from me. I will pass to Amalia.
Next, how to solve the problem. There are three ways to solve the problems. The first one is strengthening mental health surveillance system, identifying and conducting research in main area of mental health concerns, for example, addictions, workplace, prenatal population, and focusing on translational research. Next, strengthening mental health resources, building the knowledge and skill of general and specialized health workers to deliver evidence-based, culturally appropriate, and human rights-centered mental health and social care service. These include training of students, teachers in school and college, general workforce, and the medical workforce, staff working in mental health or psychological interventions to empower them with appropriate knowledge, attitude, and skills on mental well-being. Last but not least, addressing Swedish and Swedical behavior. While mental disorder cover a wide range of conditions, this plan makes special mention of Swedish. This does negate the importance of the other conditions, for which the strategies and actions identified in this plan address Swedish and Swedical behavior. The way to solve it is creating a post-version pathway for Swedish survivors, including those closely related, family members and friends. Number 2, promote responsible media reporting on Swedish. And number 3, creating survey environment to prevent Swedish. So that's all from us. Thank you.